Kick-ass fact, you may be done with this topic, but I'm not. Even more outdated medical procedures. Pew, 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 pew! When kids in the 1880s got a toothache, everyone thought it was fine and dandy to give them cocaine toothache drops. In 1884, an Austrian ophthalmologist discovered that a few drops of cocaine solution on a patient's cornea acted as a topical anesthetic. It made the eye immobile and desensitized to pain and caused less bleeding at the site of the incision, making eye surgery much less risky. Soon, cocaine was being used in both eye and sinus surgeries. Marketed as a treatment for toothaches, depression, sinusitis, lethargy, alcoholism, and impotence, cocaine was being sold as a tonic, lozenge, powder, and even used in cigarettes. It even appeared in Sears Roebuck catalogs. Popular home remedies such as Allen's cocaine tablets could be purchased for just 50 cents a box and offered relief for everything from hay fever, throat troubles, nervousness, headaches, and sleeplessness. By 1902, there were an estimated 200,000 cocaine addicts in the United States alone. Shock treatments as a cure for impotence. Didn't see that coming, did you? The Victorians honed in on a man's moral weakness as the cause for genital dysfunction, and by the 19th century, impotence was thought to be caused by either an excess of sex and masturbation or too little of it. Some doctors introduced galvanic baths, or bathtubs filled with electrodes, which were supposed to restore sexual desire in just 6 sessions. Others took a more localized approach, where rods with currents running through them were placed inside the man's urethra. The treatment would last for 5 to 8 minutes and be repeated once or twice a week. By the late 1800s, ads were being run for electropathic belts or electric belts aimed at weak men. They claimed to help cure kidney pains, sciatic nerve issues, backaches, headaches, and nervous exhaustion, but the underlying message was that they could cure your sexual problems. Electroconvulsive therapy, or ECT, in its original form, was often performed without anesthesia or muscle relaxants, which led to injuries. Also known as electroshock therapy, this treatment electrically induces seizures in patients to relieve the symptoms of various psychiatric disorders. For years, ECT was performed frequently and often against the will of the patient. It was used to treat a broad spectrum of things, including homosexuality, which was considered a disorder by the medical establishment of the day. Today, we still use ECT as a last resort treatment in cases of severe depression, but only with informed consent and anesthesia. Another book recommendation, The Valedictorian of Being Dead by Heather Armstrong. During the 19th century, parents would give teething babies and rowdy toddlers soothing syrups. Most of the ingredients in Mrs. Winslow's soothing syrups were fine, except of course for the morphine, chloroform, codeine, heroin, opium, and cannabis. It's estimated that each ounce of Mrs. Winslow's soothing syrup contained 65 milligrams of pure morphine. A lot of babies died. So many, in fact, that in 1911 it was called a baby killer. Ancient Greek physician Hippocrates recommended treating hemorrhoids by heating pieces of iron until they were red hot and attacking the hemorrhoid with them until it burned away. These red hot hemorrhoid pokers, also the name of my new Red Hot Chili Peppers cover band, would be inserted through a tube so the red hot iron could move in and out of the body until the hemorrhoids were burned loose. Shoving red hot pokers into people was still the go-to treatment in medical texts as recently as 1882. Hippocrates was practicing medicine in 400 BCE, and in 1882, yikes. In the late 19th century, a doctor was trying to treat mental illness by inducing fever. He induced fever by giving people malaria on purpose. It only worked in one case, treating syphilis. Deliberate malaria infection became the go-to treatment for syphilis from 1917 until the 1940s. Malaria was considered safer since it was easier to treat, but the malaria killed about 15% of the patients. John R. Brinkley rose to fame and fortune as one of the wealthiest doctors in America, all with a degree he bought from a sham university for $500. How did he do it? By surgically implanting goat testicles into human scrotums as an impotence cure. Brinkley's procedure was dangerous, killing several hundred patients with testicular infections. In the 18th and 19th centuries, a hemiglossectomy was used to treat severe stuttering. How do you perform a hemiglossectomy? Just cut off half your tongue. Not only was this extremely painful, but that many patients would bleed to death. Chloroform was used as an anesthetic in the United States in the 19th century and was believed to be a cure for asthma. They believed that one treatment with chloroform completely relieved all symptoms of asthma. This belief would eventually result in deaths of patients who overdosed during an asthma attack. Another asthma remedy, first published in the 1740s, was by British evangelist John Wesley, who suggested eating a fortnight of boiled carrots only.